Good afternoon, everyone. I'm Dr. Darren Vanskoy, and this is my partner, Lori Wendell, with Total Health Pros Ascend Elite Health, coming to you with another episode. Just this one, we're kind of relaxing a little bit and talking about some patients that we've had, so we can kind of give everybody a bit of an idea of what we do, what we see, and the kind of affect or effect we've had on our patients' lives. So, Lori, what else you got to add to that?
That's just basically what I wanted to add is that, the background Darren has, chiropractor, physical therapy, he's really holistic in his practice. And I come from a cardiology background. I always say I'm a plumber and an electrician from the heart and primary care. So putting our expertise together has been, as you see, as we unfold the patients over the next little bit, you'll see that both of our expertises come together for these patients and help them find the right way to be treated. And they're all doing great. So,
And we don't have a typical patient. Like, there's
no,
nobody that walks through the
no.
door. There's no one ever walks their door. It's just like straightforward. Well,
No,
a
never.
few, hey, I've got low testosterone. I know it is. My doctor won't treat me, kind of thing. But for the most part, it's never typical for us, right? Which
They'll
is
come
fine.
to for a wellness visit, and then we find too many other things. That's exactly
Yeah.
right.
So I'll let you start with one of your patients, and then
Um, I'll start with one that's atypical. A gentleman, business owner in the area in West Virginia, comes in because his secretary says, "You need to go down and get checked out. You never go to the doctor." So he comes to the doctor and he comes to see us, and we just want to do a wellness visit on him. So, of course, I'm asking him all these questions, and he's a smoker for like 30 years. I mean, just chronic smoker. But and he's short of breath, having some issues, but as he's talking to me, I'm like, "This is not smoker. It's not the cigarettes that's the
yeah.
problem. This is cardiac." I just knew immediately. So I let him continue. We go through everything, and at the end of the session, after we've gone through our assessment with the patient, by they're doing their history and so forth, that's when we do the physical exam. So, of course, I listen to him, and I listen to his heart, everything's fine. I listen to his carotids, and I hear a huge bruit, which it means there's a blockage in that artery there. So I hear that and I send him for an ultrasound of the carotid, knowing that it's cardiac all along. I look at him and say, I don't think that your symptoms are related to smoking. I don't think it's your lungs. Your lungs are as clear as mine, literally, for a smoker who's been doing this for 25, 30 years.
Well, and he's a guy too that came in thinking he just had low testosterone and
Yeah,
didn't feel good.
exactly. There you
So
go.
that was he literally said, "I just don't feel good. I think I just have low testosterone." Yeah.
Exactly.
Yeah.
So I sent him, and God bless his heart. His wife was ill. He had to wait till she had surgery. Long story short, this gentleman was delayed in his treatment several times because I sent him to a cardiologist that just changed to WVU. He had to go to WVU for a heart catheterization at that extent, had stents put in there. They failed. He actually probably is 3 months post open heart surgery. The guy's doing wonderful. He's healthy. His color's back. He doesn't have the symptoms. He was literally almost passing out at work, breaking out in sweats. I mean, every single day. And his wife was terrified that he was going to pass away before he got treated. So he finally went, and his wife literally, I see them occasionally. They're friends of my in laws, and they're like, "Thank you so much for just paying attention." And I do have to say that, not me, just the fact that he came to us is the reason he's walking today, literally. That's how bad a shape he was in. So that's a cardiac patient that came in for low testosterone.
And really, it was he's a typical guy too, in the fact that he just didn't want to go to a doctor.
Right. Didn't want to go to a
So
doctor.
part of it is he just didn't want to go to a doctor. Finally, had some smarts about him, listened to his wife, right? But he really thought it was just a low testosterone. I just don't feel good, don't have any injury
Yeah,
or energy whatsoever, and ended up with a major cardiac issue, and
exactly.
would have been probably fatal at some point if he hadn't come in. So
Literally.
yeah, so I've got one that I'll talk about. 21-year-old male kind of came into our office, actually came in with his mother because he wasn't
Oh,
feeling very good. And so he reported like fatigue, trouble putting on muscle weight, muscle mass, had issues with focus, just really couldn't put on weight, just felt like he just wasn't thriving. And so, sit down, talk to him again. He's like, "Hey, I've got low T, I think, or something going on,"
mhm.
right? And so, what we did is we looked at his lab work. 21-year-old. First of all, we don't you don't want to start on testosterone no matter what, right? Unless it's absolute necessity. But that's a long time for the rest of your life to be giving yourself a shot
Correct.
or taking some type of cream or a troche or whatever it is to treat it. So, I think we ran his blood work, we got it back, and he did have low testosterone. But the other thing, when we looked really deep, his diet was terrible,
Exactly.
had no fat diet. He was working with a trainer. He was on a high protein,
And
moderate
he
carb,
lost 30 pounds. So he
lost
was,
30
yeah.
pounds on a very low fat diet. And so when we started exploring that, his diet was actually so low in fat that it was causing a lot of the issues with his hormones. And so then we also looked at he had low vitamin D, which is a major precursor for a lot of the hormonal processes that our body uses. And so when we started looking at that and going, in depth and looking at it, really it became an issue of not having to use testosterone supplementation for him. And so what we did is we modified his diet. We put him on a high protein diet. We put him on a higher fat, significantly higher fat diet. Put him on some B complexes. Started him on vitamin D. His vitamin D was actually very low, like pathologically low. And so, it was one of those things. And vitamin D is one of those you either make it correctly or you don't. You're either out in the sun enough or you don't, or you're not. And, he was just one of these cases. It's just like the perfect storm for a young guy.
Mhm.
Bad diet. He was exercising and lost weight, just not enough fat. And so all we did was we really just changed his diet. We started him on a
Mhm.
vitamin D
Got vitamin D
prescription
supplement.
started him on vitamin D prescription, started him on a high fat again, high protein diet. And then 6 to 8 weeks later, he comes in and pretty much his numbers had normalized.
Yes,
And
it's
his trainer was
unbelievable.
really the one who sent him to us saying, "Hey, I want him on testosterone."
And let's add here that his trainer was a little upset that we
His
didn't
trainer
put him
was
on
was
on
sign was a
testosterone.
little upset, was significantly
Yeah.
upset that we didn't start
Didn't
him on
have an
testosterone.
understanding.
And he
Yeah.
didn't know, and that we run into that with trainers all the time, right? And anybody can call themselves a trainer. They don't have to have any
Mhm.
education. Most of them, especially around here, aren't certified through any credentialing body, right? It's just they've been in the gym for a while,
Correct.
and all of a sudden they think they know everything, right? And so they think they know everything about peptides. They think they know everything about hormones. They think they know everything about steroids, whatever. And so, yeah, this trainer got a little upset with us because we didn't, we basically refused to put this 21-year-old on testosterone injections, which he'd be on the rest of his life.
Absolutely.
Yeah, and
It
that's
would
that's
stop
no
his
kind of
own
life, right? I
endogenous
mean, and so
supply.
changed his diet, right? And then, basically that was really the big thing. Got him on vitamin D, easy fix. And he's way better for it. Since then, he's put on about 15, 20 pounds of muscle mass, looks like a different kid,
Mhm.
way healthier. And so, guys, it's not everything isn't based on testosterone. And again, really not really knocking on trainers, but if people are going to seek out trainers, please seek out trainers that are certified, right?
Mhm.
Really find somebody that knows what they're doing, that's credentialed, that has some experience, lots of reviews, and can show you their educational background. That, just because they look good, maybe they have a good physique, doesn't really mean they have the knowledge base to be treating and working with these people and these
We always
athletes.
stress that, but literally, I'm an example of that. We've talked about that in one of the other podcasts. I listened to my coach and I got myself in some issues. I mean, I
Yeah.
was wasting muscle away. I was, and Darren, that's how I met Darren. But it's like just because again, I have trained for how many years? Not as many as probably Darren, but I've lifted weights for over 15 years, 20 years. I'm old, I'm 60. But just because I did that and I have done, bodybuilding shows and I've competed, I wouldn't train an individual until I got certified. And I'm a nurse practitioner. I mean, I
Yeah.
would not go on as a trainer until I got certification for it. That's just who I am. And so a lot of those people may have that, but they don't, and most of them don't. And they go
Majority
by
don't.
what bro science or gym science, and you just can't trust that. I don't care if you see these people, but if they try to put you on testosterone, they try to put you on thyroid medications, do not start that until you see someone like Darren and I, and we're available.
And get baselines and know where
Get
your blood
baseline
work
labs.
is. Do not do it, right? I don't care if you're 40, I don't care if you're 20, I don't care if you're male, female, because someone suggests you do something, don't do it till you've got evidence to support that
Mhm.
you need to do
Evidence-based
it. Yeah,
practice. Yeah,
absolutely don't. So
absolutely
I'll kind of pass the ball to you, Lori. Let you go
not.
over another one.
Well, I'll stay with the cardiac. I have one more that I want to mention. This gentleman's a professional. He's a chiropractor. Um, Came in just for a wellness checkup. Now he's got a lot going on. Now, we in the medical
A
field
lot. No, yeah,
we in the
it's a lot.
medical field are very guilty about not taking care of ourselves. We get carried away with what we're doing and we don't. So the man's diabetic, wasn't taking medication for that, wasn't taking care of himself, been diabetic for many years. Had low testosterone. That was proven
Yeah.
with us. But as I go again, we're going through all those things. I go to listen to him. He's having premature beats of his heart. He's having every other beats not as it's coming sooner than it should. So I know that's premature ventricular contractions, which could indicate you have coronary disease. Um, that's just my background. So I know these things. So I tell him, I was like, I'm concerned. I want to get you in for a coronary CT. You're diabetic. You're not controlled with your diabetes. Your cholesterol is terrible. You're just not healthy, period. So He goes to have the coronary CT, and God love him, he goes and where he's having the every other beat that's irregular, they cannot do the scan because they have to have a regular heartbeat and it's got to be regular. So after lying in the scanner for at least almost 3 hours, his wife says, "I'm done. Let's get out of here." So I then went ahead and referred him to a friend of mine who's a female cardiologist, excellent interventional cardiologist. She saw him immediately. That's one thing I like about that. They get him in quickly because I do have a little connection there. So he gets in, gets a cardiac cath, and he has 3 stents today. Feels better, collar's better now. Is he doing everything he's supposed to do? No, we still have some issues with his blood sugars and with his cholesterol. However, he's been put on a cholesterol med, and he needs to be on a statin. He's a male. All studies that have been done on statins are with male clients, and they've shown some decrease in plaque. So definitely, he wants to be on that. And he's on some different things for the heart, and we want him to be on those. But um, I will add, he's on a GLP-1. He's lost 30 pounds.
Semaglutide,
Semaglutide, yeah.
Wegovy, Ozempic is what we're talking about.
He's started that since he's seen us. He's actually lost 30 pounds. He's on the road to recovery. But again, as a client, a patient, I always want to say client, a patient, you have to be responsible for your own health. So diet, exercise, and blood sugar control is up to him. What he eats, what he doesn't eat. He's kind of uncontrolled on that, but that's getting better.
Yeah.
But we have to preach that to him. And he's a professional, so he's got to take care of himself. But we've given him the path. We've given him the map and all the rules. He just has to follow those. But
Yeah, he literally didn't just have one foot in the grave. He had
no,
like both
no,
toes
but he's
dipping in.
yes, he's
And so he's got both legs out, walking around it, looking at it now. He's a lot healthier than what
yeah.
he used to be.
And he did
Massive
come, yeah, he
difference. Yeah.
came in post stenting, and I mean his color and everything's better. So he's on the road to recovery.
I
He
think the
just,
stents caused him to be a little bit more serious about the
oh
issues
yeah,
that he needed
oh
to
yes,
address. You know, when you have a major cardiac issue like that, a lot of people start to take things a lot more seriously.
yeah, and it's sad because
Yeah.
heart issues are silent until they're not silent. So he had not had
Good to
chest
good.
pain. Yeah, he had not had chest pain, had not had a heart attack. None of that happened yet, but he was almost totally occluded in one of his arteries. He has 2 stents in one of the arteries. So, you know, just pay attention to things.
Don't let things go.
No,
Right? That's the
be
big thing.
tracked and
Don't
keep
let
your
things go. Yeah. So I've got next one. I've got 38-year-old male came in complaining he was tired, had low libido, poor sleep. He had been to his family doctor, and they had told him, you know, that all his test levels were normal. He'd been tested, told that, you know, his testosterone wasn't bad, but you know that they didn't really look at everything, right? And so when we looked at him, his free testosterone was really low.
Mhm.
And so we see that all the time. And free testosterone is really the functional level that you really need to go by, right? Not your total, right? And so when we looked at that, you know, we're sitting there going, okay, so what's going on? Because everything else, all of his other metrics look really pretty good. So his medical doctor hadn't looked at his free testosterone. And so then we start running the tests and find out he's got high prolactin, right? And so
Yes.
prolactin is one of those hormones that it can bind with testosterone, the receptor sites, and basically yield your testosterone ineffective. Even if you have a normal amount, it doesn't matter if your prolactin levels are high. And so then we had to sit there and go, okay, you know, well, why is this? That's what we love, the part of the functional medicine. Okay, listen, you know, we've got a male here whose total testosterone levels are okay. His free testosterone or actual functional levels are in the tank, not functional at all. I mean, the guy, like I said, he was really tired, 38, right, coming in, and he came on his own. So it tells you he's not feeling good,
Mhm.
right? Tired, low libido, again, just everything around, just not feeling good. And so, you know, he'd been to his medical doctor for years. They tested his TSH, but never really looked at his thyroid. And so when we started diving into this, we looked at his TSH, we figured out, okay, he's never had any other thyroid tests run. Find out he's got raging hypothyroidism.
Mm.
And so the hypothyroidism was what was causing the high prolactin levels. And so there was nothing wrong with the testosterone. There was nothing wrong with any of his inherent mechanisms with testosterone production. The problem was he had a thyroid issue. I mean, he came to see us because of low testosterone, thinking he wasn't making enough. And here it wasn't even a testosterone issue at all. He had plenty of testosterone. The free was bound because of the prolactin. So we look at, you know, do the blood work very in depth, find out he's got hypothyroidism, start treating the thyroid. And all of a sudden, you know, 8 weeks later, after treating his thyroid, not doing a thing with his testosterone, the
Lo and
guy's like
behold, he's got
completely normal. Like, I mean, he's got all the energy in the world. His libido's up. He's sleeping better, you name it, right? He's responding better in the gym. And again, this is somebody that just came in, hey, I've got low testosterone, I want a shot. I mean, that's literally when he came in, that's pretty much his whole approach to it was, I know I've got low testosterone. My doctor says it's not, but I know it is because it's the way I feel. I've been told this in the gym. Again, and this is one of those things, if he'd have started testosterone
Mhm.
because of somebody in the gym telling him, and that's what he did, the problem would not have gotten better because of the prolactin binding the testosterone. His testosterone levels would have gone through the roof because he would have been taking testosterone when he didn't need to. And so then all of a sudden we are looking at some major health issues. He could have way too thick of blood from that, could cause issues with cholesterol problems, could cause issues with circulatory issues, cardiac issues, because he would have been jacking his testosterone levels so high to make a difference in how he felt. It would become dangerous. And so again, this is just another example of like, don't take things for granted. Go to a professional that knows what they're doing, that knows what they're looking for. Ideally, a functional med person, that really knows how to look at these different things and knows how these hormone systems interact. And when one thing's low, why could that be? Don't just take it for granted. Look at the big picture.
Yeah, yes, that's a good example because a lot of times we'll have someone who comes in and gets a lab workup
Yep.
and their thyroid looks like it's low, but it's only low because some other things are not where they need to be, like a vitamin D level is extremely low, or and we like to sometimes we'll say, you're a little low there functionally, but let's replace these vitamins, replace these to get these things other levels up, then revisit that because maybe it's going to improve when we improve other things.
Yeah.
So it's just like you said, you just don't take, yeah, your testosterone is low, you may need that, but what else is going on? And another thing, it's surprising how many people don't understand that women and men have the same hormones in their body. Men
Yep.
have
Different
prolactin.
levels of each, but
Yeah,
yes.
differently, and their levels are normal, but women have prolactin that brings milk, breast milk, allows the breast milk to come
Yeah.
in. That's part of that hormone for that. But men have that as well. And if it's high, it's going to block that. Like you
And it
said,
should never be high in men.
no, it
Yeah,
should
it
never
should
be
never
high.
be high. It should
And
be
that could
very
be an issue.
minimal. Yeah.
So, those are things, estrogen, they need estrogen to keep their joints moist, but
Yeah.
not as much as a woman needs. So it's just they're there in each of our bodies, but we need them at different levels.
Well, and typical too. I mean, we see this kind of patient all the time. A typical doctor, hey, you have high prolactin, probably would start him on cabergoline or something like that.
They
And
probably wouldn't check
then
it,
they probably wouldn't check it. But
to be
it's
honest.
an issue that Cabra would not have fixed for him, right? Because it wasn't the problem. I mean, it would have addressed the prolactin level, but would have never addressed the underlying thyroid problem. So again, seek out care with people that know what they're doing and that they can really go in depth. Functional medicine's huge because it is a big puzzle piece, right? And that's what we get our kicks off of these patients coming in and literally trying to figure out what's going on and really providing relief and helping that way. So
Absolutely. Well, since we're talking about thyroid, we'll go to a different thyroid patient. Now, this patient is actually a provider herself. Had history of cancer of the thyroid, had the thyroid totally removed because of that. And when you have thyroid cancer and you want to keep your TSH, which is a thyroid stimulating hormone, which is what most people run anyway in a regular routine
right.
doctor's office, but that's your pituitary telling your thyroid to release more thyroid hormone
And be active.
and be active. So, we want to, as they have cancer, you want to keep that level as low as you can. So they give them Synthroid or T4, which is inactive. So she's been on T4 for several years and she calls me up, Lori, I need to come to you. They think that I need to have more, I need to be on an antidepressant. I don't think this is right. I am happy. I've got a wonderful husband, two beautiful children. I have a wonderful career. I'm not depressed. Why do they want to put me on that? I think it's metabolic. Can you please see me? She comes and sees me. I run her thyroid level. Her T3, which is your active thyroid, was so low that she wasn't converting. The T4 wasn't
at all.
converting the synth. So, that can be a problem. It converts in the liver. So she wasn't getting that converted. So whenever I added T3, just an extra dose, I gave her like, I think 10 micrograms of Cytomel or leothreonine. It wasn't 2 days later. She's texting me, oh my gosh, I feel so much better in 2 days. So my message to her was this, look, you know what happened. I showed you what we do. You don't normally run that in your office. If you do anything, please check your patient's T3, free T3 levels. And if you're not going to do that, send them to me because you see what this has done for you. And, this is what when I worked for this office years ago. And that's what her expression to me was when I first started working there as a new nurse practitioner. I would have to send my charts for the physicians to review. I'm independently practicing now, but they would say, wow, you're looking outside the box. I mean, you're trying to figure out I said, right. I don't want to just give them a pill. I don't want to just give them a medication when if I can figure out what's wrong with them, then I know what I'm really treating. So I do that to the nth degree, to the 100th degree now in
Yeah, we don't
functional
throw
medicine.
Band-Aids on things.
No,
I mean, we
I'm
just
not going to do that. And, we were going to see what you are, take care of that, and actually be very aggressive and treat you up front. If we have to back off on something, we will back off, but we want to get you feeling better. That's the whole point, quickly and to the point.
one key point you made there, almost daily in our office, we have patients coming in doctors tell him, hey, you're depressed, you've got anxiety, you need to be on some type of medication addressing those issues. And it's not anxiety and depression,
No.
right? It's manifestation of poor thyroid function. We see that every day, and we have doctors consistently wanting to put these patients on medication to basically band-aid over the fact that it's not depression, it's not anxiety. They've got hormonal imbalances
Mhm.
that aren't being addressed, but that's how the doctors want to address them, and it's not addressing the problem, right? It's so the patient's never going to feel better.
No,
You put them on an antidepressant or
that's not fixing it.
anti-anxiety, it's not going to make them feel better, right? It's going to bring them down to a level where the depression isn't maybe affecting their life or the anxiety, but it's not fixing the issue for them. And so that's just not a quality of life. But we see that almost every day, new patients coming into our office. One of the major complaints is they're being told that they need to be put on an antidepressant or anti-anxiety medication. They don't want to be. They don't think that that's the issue, that their doctor's not listening to them. So that was kind of a key point with that. And we see that a lot with thyroid issues, hormonal imbalances in general, but definitely with thyroid issues a lot.
With the because we're on that topic, we have one female patient that this you always can tell when someone feels better because they don't text you or they don't call you very often. It progressively goes down to less contact because they're in a good place. She came to us on thyroid medication, but she was on two SSRIs, which are for depression, serotonin uptake
Yeah.
receptors, whatever. So she's on these medications and she's on like 450 of Wellbutrin. Now, I was on 150 when my dad passed away. I had some depression for about 6 months. That's the lowest dose there is. I tapered off and went off of it. But this woman is on 450 milligrams of this, plus she's on another medication. She
Yeah.
looks, I don't think I need this. I need to come off this. So her thyroid was messed up. So we got her thyroid straightened out and I tapered her down. She's on 150 milligrams only a day. Plus she's on the other, but that's where she needs to be. She obviously does have anxiety and depression, but did she need 300 more milligrams of that? No, we just needed to correct her thyroid
No.
problem. And then now she's selling. This is the whole point. And
And she feels like
oh
way
yeah,
but night and day
yes.
difference. Yeah.
It's one of those things where we always when we talk about the physicians and what they ignore, I don't want you to feel like we're just, backstabbing these providers. That's just how they're trained. They're not trained to look at anything but the simple path.
Yeah.
And that's not going to get anybody better sometimes when
Well, and it comes down
it's
to the
just not
fact that a
good.
lot of medical schools are sponsored by drug companies.
It is, and
So I mean, a lot of the medical education
they
is
want you to
based
be
on
ill.
what drug companies have provided. I mean, that's really what it comes down to. I mean, we don't have a medical system based on wellness care. It's based on sickness care because that's where the money is, right? We got
Mhm.
everybody healthy, then where are we
Right.
gonna make their money? Right. I mean, that's really what it comes down to, a lot of it, unfortunately. So, um, switching over so I can talk about a female once instead of males. We had a patient, 49-year-old female, came in. Basically, came in because really she was really having some significant issues with painful sex. I mean, really, that was
Oh,
her
yeah.
her issue, seriously affecting her life, right? To the point that I mean, she was afraid of it, but yet she wanted to be a good wife.
Mhm.
She had bleeding afterwards. Like this was a major ordeal for her.
The relationship
Yeah,
was
relationship
mhm.
was suffering from it. She'd been to her OBGYN. They basically cleared her of any kind of pathology as far as like vaginal tissue, those types of things. She was basically told, listen, this is just part of menopause, perimenopause. You're just gonna have to deal
Move
with it.
on.
Some
Move
women
on.
just have this problem, just deal with it. That is so wrong, right? I mean, this woman's life was completely being affected by this issue. And number one, it's not an issue she just wanted to come in and talk about. I mean, there is no shame in discussing these types of things with your doctors.
You
Expect,
should be able
you
to.
should be able to. And if you don't have a doctor that you feel like you have that kind of relationship with, that you can discuss that with, that they will listen to you, you need to find a different doctor,
Mhm.
right? And that's where she was sitting. She didn't feel like she could discuss this with her doctor the times that she had. She felt like they weren't listening, that they already had this preconceived notion that, hey,
Mhm.
whatever it is, you're blowing it out of the water. It can't be that bad. While she's sitting there describing these issues, talking about in tears, with
Mhm.
us.
Mhm.
And so, and it's seriously affecting her life. And the thing is, it was a pretty easy fix. I mean, again, thinking outside of the box, she'd been on some hormonal therapy before, didn't really help much. So when we discussed with her about it, and then, like I said, she'd been to see her OBGYN. They'd said, listen, there's nothing anatomically wrong. She'd been examined. So we said, why don't we try vaginal suppositories of hormones? Let's put the hormone directly into that tissue where you're having problems, where the tissue's frail, where it's fragile, tearing easily, it's not stable. Let's try that. Let's see what happens. There's a lot of evidence based studies to show that this could have a major impact. And again, she was another one, 8 to 10 weeks later, night and day difference for her.
Mhm.
Normal sexual activity, no pain, intimacy became something she was terrified of to
And then
something
now
that she could enjoy with her husband, with her spouse. Night and day difference in her presentation when she came in. I mean, when she came in, she wouldn't talk to us. She wouldn't look us in the eye.
no,
She was almost
no.
embarrassed about the issue that she had. This was awful that she'd been put through
Yeah,
this
absolutely.
and that she was at this point coming into her office. And then when she walks, I mean, completely different person, confident. You could tell she felt better. You could tell it just completely changed her entire persona. And all we did was literally think outside the box. We did the blood work. We knew that she had some hormonal issues, but she said, "Hey, I've been on creams. I've been on this before." All we did was try a different approach, right? And so that was the big difference, massive difference in this woman's life. And we see that so much with women's healthcare issues that women are getting blown off because they're just being told this is normal part of menopause, perimenopause. This just happens. Deal with it, hot flashes. Oh, it's okay. You'll get over it in 5 to 8
Just get
years.
used to it.
Just get used to it. That is no, don't get used to it. Do something about it. There is no reason to suffer through these issues whatsoever. There is absolutely none. And if your doctor is not helping you get out of these things, again, need to find somebody else that will help you and will listen and really care about what you're dealing with.
That's true, and I'd like to I'm going to mention that right now. There's a book, and I recommend it to many people. The New Menopause by Mary Claire Haver.
Phenomenal. Yes,
Great
yes.
book. And this is a layman's book, but I'm going to be honest with you. I've listened to this and I've ordered the hardback myself. I'm even thinking about ordering that and having it available to women in the office because it is an absolute amazing book. And, she shares as an OBGYN that, back when she was in med school, they go, oh my God, it's one of those women again. Oh my God, she's here to see somebody because she's having hot
Those
flashes. And
crazy women,
as crazy
problematic
women.
patients. Yeah.
Now, she did this for 20 years. And then one morning she wakes up and she's got a hot flash. And she had to look herself in the mirror and say, oh my God, I've done a disservice to my women. She was an OBGYN delivering babies, taking care of women's health. I have ignored these people for 20 years. Now I'm experiencing this. So this is what she had to do. It's a hard realization to say, what am I going to do with my practice? Am I going to keep delivering babies, seeing people every 15 minutes, ignoring what they're telling me, being on call, doing surgery, or am I going to change my practice to take care of the women that are ignored? So that's what she's done.
Yeah.
I mean, she's an amazing woman, amazing provider. That's a good book for you to look at. I mean, she just talks about how, and it's reported with the Women's Health Initiative 20 some years ago was a study that looked at estrogen and its benefits for women, and they reported it incorrectly. It came out incorrectly reported, but that didn't matter when they tried to correct it because 80% of women stopped taking estrogen and no physician would write it. And
Wouldn't
that's
touch it. Yeah.
continued until now. That's why in West Virginia, people come, no one will write me hormones. No one will check my hormones. They don't know what to do with it if they check them. I have a coach, an old gymnastics coach I ran into this morning to my oldest daughter that said her husband literally went back into her primary care office and demanded a prescription for her hormones to be checked. He walked out with it, but she didn't get it when she asked for it. They said, we don't have to check.
Yeah. Yeah.
And she said, it's a godsend. You walked in here to say hello to me this morning because I'm coming to see you. This is
And we see this all the time.
all the time.
All
And
the time.
it's just that study halted women's health for 20 years. Now we've got to get that back, and then we've got to be aggressive
And
with
all
it.
the new studies and the science are coming out
Yeah,
showing
there's a
that
new
this
study.
estrogen is not the demon. That if anything, I mean, it's a savior of issue. I mean, so many women need to be on these things, right? But it was demonized forever
Yes.
because of this one poorly done study, poorly interpreted
It was
study.
interpreted incorrectly online.
Yeah.
And there's a meta-analysis that just came out in March. I've not actually read the entire study, but it's taken all the estrogen studies and put them together, and the benefit way outweighs the risk.
And for the most part, showed that women
Absolutely.
on estrogen actually had less chance of breast cancer development than women who weren't.
Correct.
I mean,
So that fear,
yeah.
that's fear mongering. Take it away. Get your
absolutely,
levels checked.
100%.
I don't care if you've been in menopause for 10 years. We can correct if you're having issues, we can correct those. I mean, we may look at you cardiac risk wise. If I have someone who has an elevated LDL, and that's what happens when your estrogen drops, your LDL cholesterol, the bad one goes up. So if you have family history and you have problems, I may have you do a coronary screening, a CT scan of your heart that's quick and to the point, tells you if you have any calcium in there. And if it's clear, then we're going to be aggressive with your estrogen therapy.
Yeah.
10 years out, past 10 years, you might not have as much of a benefit, but you will have something.
Well, you'll feel better.
You'll feel better.
I mean, that's will lead right into the next patient I'm going to talk about. I mean, the menopause affect, perimenopause affect on musculoskeletal issues
Mhm.
is huge, right? And they're really just starting to look into this now in regards to women's health issues, in regards to why so many women in that perimenopausal menopausal area having so much joint pain and musculoskeletal issues, muscle weakness, joint pain, joint swelling, inflammation, right? Failure to thrive. They just don't feel good. They don't want to exercise. And it's because they hurt, right? Well, estrogen, come to find out, estradiol is a very potent anti-inflammatory. And so that leads into this case study. I mean, we had a 50-year-old woman come in complaining of bilateral hip pain, knee pain, shoulder pain. Major complaint was plantar fasciitis, right? Had been doing everything possible to control the plantar fasciitis, anti-inflammatories, icing, splints, this and that, you name it, she's done it. No help whatsoever. So we start looking into it, and she's been told, hey, blown off about other hormonal issues. Again, we see that over and over again. But when we look at her blood work, lo and behold, her estrogen is absolutely in the tank,
Not
right?
detectable.
Not detectable, just not there. And so, it, no brainer. Okay, let's start on it. It's a potent anti, both for men and women. Estrogen. That's why when guys' estrogen levels drop way too low for numerous reasons. Sometimes
Joints
bro
hurt.
science are taking Adex or an Anastrozole or Remedex is what the gym rats call
These
it,
are blockers for your estrogen.
estrogen blockers,
Mhm.
and they're doing it so they can look better, right? Or they're holding water, or usually it's because they're on too high doses of
Mhm.
testosterone. And so they're taking a medication to counter effect bad
Bad
medication,
vacation they're on.
bad medical advice, right? But and guys get joint pain. If your estrogen levels as a guy goes really low, you absolutely are going to have some joint pain. Well, why wouldn't that make sense? Women are going to have the same issues
Mhm.
too, right? Again, physiology is physiology, right?
Correct.
And so, when we start looking, sitting down, talking with this woman, this is what's going on. We started on estrogen therapy, replacement therapy, hormonal replacement therapy. Night and day difference. Plantar fasciitis goes away, knee pain goes away, hip pain goes away, shoulder pain goes away. She's back in the gym. She's exercising regularly, truly enjoying life, being very active again. She could have been on every anti-inflammatory known to man. She could have done that, and it would have never helped unless somebody addressed the hormonal replacement issue, right? And so if we hadn't addressed that, her life quality would have never gotten any better. She probably would have ended up on pain medication. Who knows what else she would have been? Probably antidepressants because she couldn't do the things that she wanted to do. Wasn't enjoying life. Had been somebody that enjoyed exercising regularly. Whether in the gym or being out. Outside just walking, whatever. She was extremely limited, mainly because of the plantar fasciitis. And so we're starting to see this a good bit as plantar fasciitis being an affect or a presentation because with women, who constantly, right, we're seeing this plantar fasciitis issue, right, with postmenopausal, perimenopausal women. Again, a lot of times it's a lack of estrogen, right? Start on estrogen, all of these things just have a tendency to clear themselves up. And so that's what happened with this patient. And so a simple fix, right? But yet, if she hadn't come to us, she would have been treating plantar fasciitis forever. It would have never gotten better. Probably would have had to have injections, maybe end up having surgery, surgical release, who knows,
And
right?
that's a
But
pretty tough
it's
surgery.
it's a very tough surgery. More than likely, she would have never gotten better. She would never found the relief. And all it was a hormonal imbalance that we did. We took the time to listen to her, look at blood work, fully investigate what was going on, all the possible reasons it could be there. Literally, the only issue she had was low estrogen. Testosterone was in good shape, progesterone was in good shape. Typically we don't see somebody that's got good progesterone levels and bad estrogen levels. Typically, most women are highly estrogen dominant,
Yeah.
in the
And
younger
have lower
years
progesterone.
and very low progesterone. But this was the case that she had good progesterone, good testosterone levels for a female. Her estrogen is just in the tank, right? Put her on estrogen, night and day difference. Very happy patient.
That's a good point that I'm gonna throw my experience in on this because even though I've been on hormone replacement, I was on oral replacement before we started working together. I went on to bioidentical hormone replacement after we started working together, after I reviewed my own labs, and I got that started. My estrogen has really not wanted to come up. It's kinda stayed lower, and I battled plantar fasciitis. Oh my god, it's finally gone. Now I have a heel spur that I have a little bit of problem with, but you know why that's finally gone? Because I finally realized my pregnenolone level, which is a prohormone. I've been on DHEA that helped my testosterone come up as a woman, but the pregnenolone I was not taking. So I started taking that. My estrogen is now at 60, and I've been menopausal since the hysterectomy 8 or 9 years ago. My estrogen level was 110 when I checked it. It probably hasn't seen 110 in I don't know how many
Yeah.
years because it was low. I mean, probably low the entire time I was on the oral, and that's how I met Darren too with hip pain. That's I presented to him with hip pain, so I know it was estrogen related. Now that I've got that, I will do anything to keep that level there. because that has to be why that's better. Because he knows I've battled it for on both feet,
Yeah,
on
hormone
both
flow
feet.
all starts with vitamin D and pregnenolone. Right.
It's
So, I mean, if you're going to a provider and they're not checking that, you need to insist that that be checked, right? Because
ask
literally
for these labs.
everything starts with pregnenolone.
Ask for them.
Everything does. Everything is made from that. Vitamin D goes into that. So if you have low vitamin D, pregnenolone is going to be low, number one. You can have, we don't see it very often, you can have a very normal, actually good functional vitamin D level, and pregnenolone be low. But typically, it's a low
They're going
vitamin
to
D
kind of
that
be
causes,
down.
that causes it. So, it's one of those things, get that checked because everything, as far as hormonal imbalances, typically start with pregnenolone. You can be put on hormones like Lori's talking about, and unless that pregnenolone level is there therapeutically at the threshold that it should be, those hormones still aren't going to be as effective as what they would be if your pregnenolone levels are normal.
I'm going to mention here that you're probably not going to get that order from anybody other than functional
No,
medicine.
unless you ask for it.
Unless you specifically,
You're going to have
and
to
that's one
specifically ask
thing
for it. And it's huge.
you can contact us. We can tell you things you should ask for, or you can come see us. In Mary's book, she mentions things. You ask for these labs. There's lists for that. It's just, and I will mention here too, since we're mentioning the female hormones, I don't have a uterus, but so you wouldn't think I would need progesterone, but progesterone helps estrogen move into the cells. And if you so progesterone is very helpful to be on people that
Yes.
don't need it, that you don't have a uterus. I take it. My progesterone level doesn't come up very high, but it actually pulls the estrogen in as well as the pregnenolone helping. But like not everyone's the same. We have to tweak these things for individuality. I mean, you're not going to be, oh well, Lori's on this, that'll work for me. No, not
It'd be great if
necessarily.
there was a cookie cutter
There's not a
type.
cookie
Yeah,
cutter on
there's no
this.
protocol for it. It'd make our job so much easier, but
We
there's
can't
just
make it that
you
way.
just can't. It just doesn't work out. Love for it to be that way, but it's just not. So
Well, I'm gonna come off with a new patient. I actually posted her, and her name is on my Facebook page, but I won't mention it here. But came in with her total cholesterol was 260. Her triglycerides were 169. These are the initial labs. She had no hormones were non-existent. She had March lab work done in March. Her thyroid was not functioning. She's her vitamin D was in the toilet, as we want to say. Had no energy, no motivation, had gained weight, brain fog, tired through the day, tired in the afternoon, waking up at night, all these things. These are the typical, we hear this every single day. Well, now that we did a liver protocol, this is something that, I mean, trust me, the cardiology person I am, Darren knows I buck him. I used to buck him on these
we
things.
had
I mean,
quite a battle over
I had to read, had to learn.
we did.
And we get along quite well, but that was one thing I'm like,
Extremely, yeah.
listen, I'm not, no, they have to be on a statin. So her cholesterol was, so her LDL was high. She didn't mention that. It was very high. But we did liver protocol on her. Her total cholesterol went from 260 to 129. Her LDL cholesterol, I think it dropped like 40 or 50 points, literally after 3 months of liver protocol and using
Addressing the
red
liver,
yeast
yeah.
rice, okay, addressing your liver. Her triglycerides went from 169 to 72, which we like to see that triglycerides below 100 is where we want to see them. Hormones are now existent, and she has enjoying what she's doing, enjoying sex, enjoying, her daily life. Thyroid's functioning now. She's lost 14 pounds. Vitamin D is up to normal. She has energy. She's got motivation, and she just feels so good after, and finally able to not fall asleep when she sat down on the couch.
Yes.
So this is the type of person that she waited to post this, and she took her cholesterol labs to her doctor to show him. His answer to her was, well, you better watch what they're giving you, that stuff. You never know what you're taking when you get that stuff. She said, I don't care what I'm taking, but look at my labs. This tells me something works.
Labs don't lie.
And this is my labs.
Labs do not lie.
So, and that being said, with the cholesterol, and our arguments about that, we have like 2 couples that have it's almost like they are identical in their labs. I mean, their cholesterols are so grossly elevated, and they're 2 separate married couples. Well, the man, I said, you need to be on a statin. He said, I am not taking it. I went to your cardiologist, and I went there, and she's worked me up. I'm not taking a statin. But I just now, and after his wife did the protocol for 3 months, literally her LDL cholesterol was almost 200. It was 96. That is no exaggeration. So he says, I've already ordered what she's taking. I'm going to do that for me. His has come down. So my whole goal with this is to look at how we're treating these patients, and maybe looking at them, pulling those charts a year from now, getting those lipids again, and keeping them on the red yeast rice, and look at where they are. Because, if you have a calcium screening score and you have no calcium in your heart, there's no calcium in the vessels, that's showing old plaque that's built up. And you may have some soft plaque we can't see, but look, it's not old.
Yeah.
And you're not occluded. So if we can get your cholesterol down, a natural way, then by golly, we're going to do it. And, like I said, most of those studies on statins are all on men. Women have not really been studied. So we don't always know if
How they'll
that's working on
respond and
them, how
what
they're
you
responding. But, now if you do have a stent in your heart and you have coronary disease, I'm going to put you on a statin. You need to be on that because
there's
you
some
have
issues
that.
that can make a very good argument.
Yes.
Yeah.
But when you don't have any of those diseases and you get a calcium screening back that mine's 0, my calcium screening is 0, and the woman that I was very concerned about recently, hers was 0, there's no plaque at all. Why do you need to be on a statin?
Yeah. And really when you look at it, real health probably begins with the liver to a major
Yes.
extent. All hormonal modulation modification, thyroid T4 to T3 occurs in the liver, right? Testosterone conversion occurs in the liver, right? There's just so many things. We see so many of these young women coming in, painful periods, issues with periods, being put on birth control, this and that. Probably a liver dysfunction, right? And when I say liver dysfunction, your liver enzymes can be normal, but that doesn't mean your liver's functioning the way that it should. And so that's what we're seeing a lot of these issues. If you address liver health, makes a massive difference in all these other issues. And some of them completely subside on their own once the liver is functioning the way it should.
And gut, he does the gut.
Liver and gut
yeah.
is huge. But the liver, there's just so many hormonal processes that occur within the liver or because of liver function. That it's one of those things that, really a lot of health begins with the liver. And so we do a lot of work with that. Especially when we see, how many women do we see coming in with these, perimenopausal, menopausal bellies, right?
The bellies.
And that could be several different things. That could be some bloat issues because of digestive issues. That can be a liver dysfunction. That sometimes can be some late onset type of PCOS issues. A lot of times that we're going to see insulin resistance and estrogen, low estrogen
will
high
do it.
insulin resistance, high cortisol, and you get this little lower belly pooch, right? Because that's the perfect storm combination of where fat wants to get deposited because it can't be managed correctly. A lot of that, again, is basis in the liver, right? And so, the liver health really affects so many different things. We can't even begin to stress really that's got to be looked at. And we've gotten very lucky in the fact with the liver protocol that we've come up with, so many patients that are being addressed with it without having to be put, their health being reversed, going from very unhealthy to healthy just by addressing the liver, right? And digestive issues and the lower GI tract.
There's got to be a mechanism with this whole setup that we're using that because the LDL receptors in the liver that actually are there to pull that bad cholesterol out and send it to the gut and get it out of your body. Whatever's happening is allowing those receptors we're allowing them to be more responsive to the LDL and the diet, and it's getting pulled out. So
is it chemical
I don't
toxicity,
know.
environment, what it is, but whatever it is, the liver's not functioning correct. Even though the blood work shows the liver is okay, liver function is still limited, which is why we're seeing these LDLs go through the roof, triglycerides, these other types of things. Of course, a lot of times a patient can have a fatty liver without actually liver disease, right? And so that could cause some of the problem, interfering with some of the liver function. There's just a lot of issues, but it's one of those things. Find a provider, seek somebody out, and it could be just a liver issue, right? Some of these hormonal balances, especially if you're a young person, and when I say young person, really that's gonna be like 35 and under. If you've got hormonal issues, females with irregular periods, painful periods, abnormal bleeding, gut issues, those types of things, a lot of times that's going to be a liver function issue, or it's going to be a problem with probiotic imbalance within the gut. So, find somebody that can address those. If you don't know anybody to address them, give us a call. Yeah, love to talk about it with you for sure.
We do have one more patient I'll mention. She came in. She's a nurse by trade. I didn't give you your ages, and I should have given you ages on these clients, but usually they're in the same age group we're seeing here, and usually some of them are younger, but if they're usually 40s to 50s, most of the clients I've spoken about today. But she came in and she says, I'm just overweight. I cannot lose weight. Travels for a job, and just inflammation, joints hurting, can tell I'm just inflamed all over. So we did her labs, and of course she was very insulin resistant, basically metabolic syndrome, which that whole thing has hypertension. Your hip to waist to hip ratio is larger. You're just potential for coronary disease this way. Major. So her hormones were a little out of whack, so we fixed those. But basically, looking at her all over, we figured out that she said, listen, you need to do a food inflammatory test. We need to see what foods are called. What are you eating? She shows it was a lot of inflammatory food.
Yeah.
Traveling in airports, eating what she could eat, poor diet. We ran this test on her, and she's like, oh, my God, what am I going to eat? That's all that's in the airport.
Like everything reacted
Everything she reacted to. So I was like, okay, this is what you need to do. We gave her examples, protein potato chips, Quest chips, cheese sticks. These are things you can put in your bag and you can travel with.
Carry with you. Yeah.
Carry with you. So she started doing that diet change up. She was able to continue to take her food with her. Protein shakes, powder, she could mix that, whatever.
And you notice we're not saying protein bars because most of those have a
They're
ton of
a lot
sugar,
of
ton
sugar,
of junk in them.
sugar, alcohol,
Yeah,
all
so
those
protein
things.
bars we're not huge advocates for.
Not
You're not
advocates
going to hear us really ever recommend a lot
You're
of
gonna
those.
if that happens, if we eat one, it's because we're at that's all we got.
Yeah.
We're not gonna do it. So basically she changed the diet up. She did have the metabolic syndrome situation. Her I think her BMI was 39, very high. So we got her on, I think it was Zepbound, which is for diet weight loss. They wouldn't approve it initially on Mounjaro because I even said she had metabolic syndrome.
Yeah.
All these, they wouldn't, but we finally got her Zepbound approved. She's lost, I think, 30 pounds. Is it 30 or more?
A little bit more than that.
A little bit more than that now. Her husband was in today for a chiropractic visit.
She's actually 42.
That's right. He told us
Yeah,
that
42.
42 pounds, feels great. I mean, she actually posted on Facebook as well. I shared that on my Facebook page. But absolutely, you wouldn't believe the before and after pictures. And she
Looks
says
like a different
because
person.
of her diet change,
Skin tone, texture, color, everything.
she was very insulin resistant as well. So she's one of those people that just needs to have that GLP-1. Now, of course, when you're on these, and we're going to mention this because this is a topic that I want to make sure people understand. These medications or drugs, they help you lose weight, that's for sure. But when you take these, you're not hungry. You have a slowing of your motility of your stomach. So they're great for weight loss. They're great for controlling your blood sugars. They're great for even thyroid patients. I mean, they're great. But what you have to learn to do is eat on those drugs.
Yes,
You can't.
whether you feel
You've
like
got to
it or
have
not, to an
protein
extent.
intake. They say that if you eat the protein, you don't get as nauseated. I'll give you an example. We're always the people that try things to take. How's the patient feel on this? So I come back from my vacation. I don't take the lowest dose. He's laughing because I took
This is
the
kind of what
the
you
next
do.
step up dose. Oh heck, I'm just gonna take one shot. What the heck? I'll just take it. So I take this injection, and I am not for 2 days. I'm so nauseated. I can't eat. And
I
everyone who
actually
knows
felt bad
me,
for it.
anyone who knows me knows I'd rather have a fractured bone than be nauseated. I don't like it. So I deal with this for 2 days, and then I'm like, okay, I'm over the nausea. I had to force myself to eat. I was not literally hungry with my stomach growling for 2 weeks. So I know if someone's on those medications, that's how they're doing. And I think they're great, but I'm off the deep end on this one. I feel like that they should be like really microdosed. And as long as you're losing weight, you stay on the lowest dose that's there. When you hit a standstill, then maybe bump you up. I don't think we need to bump you up so quickly because I think if we stay low, allow you to eat and get you used to it until you start don't lose weight. I think that's probably the best way to keep yourself trained to eat correctly. My sister's lost 30 pounds on Ozempic, but she's a physician, so she's conscious that she's got to eat, and she's more educated on that type of eating. But some people, they think, oh, I'm losing this weight, and they're great. And then when you go off that, the weight goes
Or
right
they
back
think
up.
more is better.
Yeah.
You know, if you're on base dose, say tirzepatide, Mounjaro, say Zepbound, right, 2 milligrams, and you're having benefits from that, you don't need to go up. You're not going to
Stay on
increase
that
the
dose.
positive effect from it. By increase if you're doing well on that dose, you're only going to increase the chance of side effects, not feeling good, having those issues that you've got to address. And then the other thing with these that we're talking about, like with Ozempic, Wegovy, Zepbound, Mounjaro, if you go on these medications and you don't learn to modify your lifestyle,
No.
don't learn to modify your diet, you don't start exercising, right? And you don't do these things that are going to change your lifestyle post-medication, guess what's going to happen when you stop those medications? You're going to go right back to where you were, and more than likely even worse. Your health status will not be better. It will have declined from where you were in the beginning because you're not doing anything to modify your health. You're simply relying on the medication to make you nauseous, decrease motility, decrease your appetite to get you healthy. But that's not healthy whatsoever, right? Because you're not learning anything, you're not changing behaviors. So if you're on these medications, really look at and you can't be on them forever. Right?
No, we like a 6 month
There's no
time frame.
long-term studies showing that they're safe to be on, really over 6 months. They can start having issues on the pancreas. They can affect thyroid function. Like there's a lot of things that these medications can screw up if you're on them long-term. Long-term being over 6 months from what the studies show now. But if you're going to be on these medications, you have to come off them at some point, right? And if you don't modify how you eat, if you don't modify exercise, if you don't modify thought processes, lifestyle, you'll be right back where you were, just as unhealthy. After all of that time, the money spent, the time spent, the discomfort, right, being uncomfortable, because you're going to have wasted all of that 6 to 8 months of time, and you're going to be probably, like I said, less unhealthy, less healthy than what you were before, more unhealthy than where you even started.
I put
So
that on
those,
the same page as like a
yeah,
person who has gastric sleeve or
bypass,
gastric
sleep, yep,
bypass. You know, they make you go through therapy and to talk about your food and your diet and I think I have two people that I know that have had that, and there's a lot of people that have had it
yeah,
that have kept their weight off because they're going to do back to the same lifestyle. They gain their all the weight back and then some. It's like being on keto diet, being on the Atkins diet. My brother's
and you
done
don't
it 5
reverse
or
diet
6
correctly.
times, and
Yeah,
he just gains back what he gains and 5 pounds more every single
yeah,
time. If it, you don't, you've got to learn. It's not there's no easy fix, people. There's no easy fix. I mean, you have
no,
to modify your whole life to be healthy. And I know it sounds like a drudgery. It sounds like you're going to go uphill, but I kid you not. If you get yourself to we do it. We know we eat healthy, and if we eat something wrong, we know we feel it.
you
And
can
you will
tell it.
learn that. You will feel
Absolutely.
it, and it's okay. We're going to do that every so often. But you got to realize, oh, I'm going to feel like this if I eat this. But it's just something. If you want to be around for your grandchildren, you want to be healthy for your children, and be able to get up and down and take care of them, run and play with them, you've got to keep yourself at a healthy weight. You got to keep your heart in check. You got to keep. I mean, these are things that it's responsibility. I've got friends that will spend money on their brows, their lashes, their nails, their hair, their skin. But
Everything's
if your
superficial.
estrogen's low, your skin's never going to be right. You have to.
Yeah,
With a low estrogen, your skin's not
and
good.
your health's not going to be right. Your gut's not
No,
going to be right. Your
and
heart's not going to be
you
right. Yeah,
spend all that money to aesthetically look great, and you don't spend it on your health. They don't come and see me; they'll see all these other people. And I just preach them, please, just take care of yourself. Just please take care of yourself. And that's what we just want. It'd be our ideal world, utopia, that everyone was healthy. We
yeah.
can't make that happen. We can make you as healthy as you can
You
and
you'd be
optimize your health.
so much happier. People just don't understand, and that's like I said. I've never met you. We meet overweight people all the time who say, "I'm very happy the way I am." Yet, I have never, ever in 30 years doing this, have never met or talked to somebody that lost 30, 40, 50, 60, 100 pounds and said, I was happier when I was obese. I felt better. I had a better life when I was, it just doesn't happen, right? It just doesn't, because there's just so many things that happen in a positive manner when you lose that weight, you take control of your health. Now, you don't have to have 15% body fat. That's not what
No,
we're saying.
no.
We're saying just have a lifestyle that lends itself to being healthier, eating healthier, making smart choices with your foods. Who doesn't like ice cream cake every now and then? Who doesn't like having Mountain Dew or something like that, right? We're not saying that. We're just saying, though, taking control of your health, being a participant, proactive in what you do and your choices that you make, exercising regularly, controlling your diet, those types of things go a long way in how you feel and overall how healthy you are. And then how active you feel, and how much more you can do as you get older. That's the thing. I'd love to see everybody being an 85-year-old like her mother,
Yeah.
out, not that she's 85, but,
She's 83. She's
83, but
close.
out mowing their own yard, super active. I mean, it's crazy what this lady does, right? And it's obvious she's taking care of herself. And I would love to see every male, female patient we have be 85 years old, 90 years old, driving themselves everywhere, enjoying their life with their great grandchildren. Like, it's crazy. And, but most people are shooting both of their own feet off by the time they're 40, and then they don't ever take charge of it from there on out. So,
And you have to realize that you have genetic things that are passed. You get cards passed down from your parents, and those genetics are going to be there for some people. But just because you had that doesn't mean you have to throw in the
right.
towel. Oh God,
You don't
I'm
have to
out.
limit yourself. Yeah.
No, you can be as healthy as you can be, and you can have those genetics, but you can actually do much better than expecting that to
Quality of
happen to you.
life,
The
not
quality of
necessarily
life.
quantity. Right. That's the big thing. Live life as best you can. Absolutely. So, but again, we've covered a lot of different things,
A lot of things
here,
today.
going over, a lot of our typical, which is most people's atypical patients, but kind of our typical patients, and what we cover, what we see, what type of issues we address. But I mean, like, literally, we're kind of health optimization experts. That's what we do. Everything we do isn't necessarily related to hormones. It's some things we do. Some people just come in for literally like health coaching, proper exercise, proper diet, those types of things. Overall, their hormones are healthy, right? They just want to be healthier, right? So we look at that. We do body composition testing, you name it. We do all of it. So if you're wanting to be a better version of you, that's really, call us. That's what we love to do. Now, if you're an atypical patient that you talked about here, and you think you've got these issues,
Well, maybe I need to go see them.
yeah, absolutely call us. Like I said,
love to see
we
you.
love what we do. There's never a day I get up and say, man, I've got to go to work today.
Nope. Not
We
anymore.
both absolutely love what we do. We love our patients. We're very thankful, very blessed because of it. So guys, seriously, you can find us anywhere. We're on Facebook as Ascend Elite Health. We're on Instagram as Total Health Pros. We've got our YouTube page now. You can find us on the web at www. It's totalhealthpros.com. There's just so many places, right?
And actually there
yeah.
you can click on, and there's numerous venues to watch our podcast
Yeah.
or our these things. They're on different, they're on YouTube, they're everywhere. So if you go to
Spotify. We're on Spotify now. So yeah. So guys, really, there's no reason if you need help, seek it out. You can find it. You can get a hold of us. We'd love to help you. Love to work with you. So any way we can help you, please let us know. I'll put my phone number out there, 304-382-2080. Give us a call. We're here to help. Guys, we love you. We appreciate everybody. Thank you so much for all you've done to help our practice so far. And again, give us a call if you need help. Love to help you. Thanks.
Thanks. Bye.